Hi, welcome to Straight Talk. Today we're talking about the opiate epidemic. We're looking at treatment. There's so many questions people have about how do I get someone into treatment? What's the best treatment? What works the best? Outpatient, inpatient. There's a million questions about treatment. And what we want to do on Straight Talk today is kind of go through it from the beginning to the end of treatment with an expert who's been in the field for a long time, who really knows her business and what's going on and will fill us in, and that is Viktoriya Karakcheyeva, who is the clinical director at the Fresh Start Recovery Center. And you're located in Gaithersburg, Maryland. And you're the clinical director, and welcome.
Thank you.
Welcome
Thank you
to
for
the
having
show.
me.
Thank you for agreeing to do this. And hopefully we'll educate the public. That's the idea.
Absolutely.
Give me a little bit of kind of like your observation. You've been in the field a long time. You've watched this epidemic start, and you see where we are. How do you sum it up as far as what you're seeing at your clinic?
Well, we definitely see opioid use on the rise. A lot of young people that come through the doors of our clinic are in great need of help. Majority of our clients are between ages 18 to 28. So obviously it's affecting young people. The start age of use can be as early as 10, 12 years old, unfortunately. We see predominantly male population entering our treatment facility, which doesn't mean that female are not affected. It just it happens so that females are a little more hesitant to seek treatment due to various family obligations, having children, and of course to admit to a residential program, for example. You know, you need to have those arrangements made to take care of your loved ones. But this is what we've been seeing lately in our center, and definitely we are trying to do our best to help those young people that are seeking help.
Now, when you've got someone out there and they have a loved one who has a problem, and they pick up that phone and they call Fresh Start or any other program in the country, what should they be looking for in that program?
Well, they probably want to make sure that their loved one is comfortable. They are in a safe and supportive environment that can be controlled, as well as provide enough tools for this person to gain during treatment, so at the end of it they can be equipped to handle their addiction independently. So in our treatment, we have several levels of care that can accommodate that. We work very closely with families. That's a big portion of our work, so we want to be that collaborative effort. We offer family sessions where we open this conversation of, okay, how is your addiction affecting your loved ones? There are things that maybe you're not seeing, but they're seeing.
Right.
And very often that's the case. Very often people come to treatment because you know, the loved ones are pretty much giving them an ultimatum. Okay, well, I'm not going to continue being your spouse if you don't seek help, or you won't be able to live in this house anymore if you don't seek help. So very often those ultimatums are kind of a push for a person to enter treatment, but then hopefully in the process they start seeing things and gaining more awareness where they can understand, yes, it is a problem, yes, I need to get a better grasp on it.
And then when they come in, your role as clinical director or whoever does an intake, who comes in? Does the whole family come in? Do they just drop off the addict and then run? I mean, what's that intake part? Because I think that's a little scary to people.
Absolutely, and especially if this is your first time and you don't know anything. Well, before we go to intake process, let me tell you that we have outreach team that works very hard to reach out to people who are in need of help. and they have been collaborating with local hospitals, with Azure treatment providers that are looking for opportunity to send their patients to substance abuse treatment. They've been going to the streets and meeting people that are using and reach the rock bottom, and they are desperately asking for help. So there are various ways people come to the treatment, but outreach is where it starts. Typically, they do what's called pre-screen with the patient who is potentially admitting. So they would assess what is the drug of choice, how long have they been using, what are the consequences of use, whether they might accumulated some legal charges as a result of it, or maybe there are family concerns, so employment or school concerns. So all of that goes into the pre-screen. We also screen for co-occurring mental health disorders, because that's also something that very often accompanies substance use. So we ask whether or not there are anxiety, depression, bipolar that has been formally diagnosed. Are they taking medications for it? Have they been in formal treatment for whatever co-occurring disorder they have? Are there risks? Are there self-harming behaviors of thoughts, or thoughts of harming someone else? We also assess overall general health of the individual, because let's say you have a high blood pressure or diabetes. Those are things that, of course, with the medical care can be addressed, and we take people with various somatic dispositions, but we want to know what they are bringing in.
And this is a pre-screen.
This is just a pre-screen.
This is a pre-screen, so you really know what's going on in their life before they even get into the center.
So we are trying to get some history, and then I review that pre-screen, and I make determination whether or not that will be a good fit for the program. We typically would like that person to be medically cleared before they admit. So if person is coming from an Azure facility, it's easier because we know they've been, let's say, through detox, so maybe they've been through an Azure partial hospitalization program and just looking for a step down to something less intensive. But if person is coming from the streets, we would like to make sure that they are stable enough to be in our program. So we typically would send them to the emergency room to get cleared, and then after that's done, they can admit. So that's when that intake process that you were talking about. Yes.
Okay. Well, you got us to that point.
Yes.
Which is fascinating and so helpful to people. So when we come back, we're going to take that into the next step, which is you accepting them and what goes on in treatment.
Right.
So we're talking with Viktoriya Karakcheyeva. I know
you're getting better and better.
I'm trying so hard to get your last name. Say it for us all.
Karakcheyeva.
Karakcheyeva. Okay. Who's the clinical director of the Fresh Start Recovery Center, which is part of the Amatis Health network of treatment centers. I want to say that. So when we come back, we're going to keep talking. Stay with us. We've got a lot of good information from Viktoriya about treatment. So we're coming right back to Straight Talk.
Who helps a hero? Who tells the story of their scars? The freedom and safety of so many, of us all, is earned by the sacrifices of so few. Who helps a hero? We all do. The Gary Sinise Foundation works to support America's defenders and strengthen their families through entertainment, the construction of smart homes for our wounded heroes, and by inspiring and educating others to also support the veterans within their own communities. We enjoy the benefits of their sacrifice and service each day. Now it's time we serve them. Find out how you can help our heroes at GarySiniseFoundation.org. While we can never do enough to show our gratitude to our nation's defenders, we can always do a little more.
Calls me googly eyes.
You know you're beautiful, right? You know that?
Even you're beautiful. I got bullied for wearing glasses. Share if you're against bullying.
We put it out there, just took off. 3 million people have shared this post. Don't let bullies get you down. I stand with you. Our whole family's wearing glasses. I wear glasses and I'm proud.
I even have the army on my team.
All the kind comments brought my child joy. I don't feel thank you is enough.
That's
Hi, welcome back to Straight Talk. We're talking about drug treatment, opiate addiction, how to help somebody, what happens when they get help, and giving you, the public, an understanding of what goes on. And walking us through this is a real expert. She's just doing a great job. Viktoriya Karakcheyeva, close?
Yes.
We're getting
you're
better
doing very,
at her
very
last name. Who's the clinical director of the Fresh Start Recovery Center. It's in Gaithersburg, Maryland, but she's just a great expert, part of the Amatus Health system of drug treatment centers. So Viktoriya, in the first segment we got someone who's calling in, you got the pre-screen.
Okay.
Now you get them into the center. And what happens now?
Okay, well, we are going to do an intake assessment, which goes into your history even deeper than that pre-screen. So we have an intake assessment coordinator that meets with a client and asks a lot of questions. And it's typically about an hour process where you go through those questions. There are several forms they need to sign, several screens that we would do to assess, are you able to take care of yourself? Are you able to be ambulatory, meaning you're mobile? Are you able to sit in groups, for example, and listen to what your group presenter will tell you? So those are things that are needed for you to receive the most out of the program. Then we will also assess whether or not there are risks for you to hurt yourself. This is a big one. Like I said, there are lots of co-occurring.
You had mentioned about mental illness being a big part of that co-occurring disorders.
Absolutely. And I should mention that, as you guys probably know, addiction affects various facets of brain. And its reward system, its memory, and its motivation. So the way addiction affects us as human beings, it kind of lowers our self-preservation instincts. Why do we see so many overdoses out there? You know, part of it is probably people, not careful about how much they take in, but part of it, it's a self-harming behavior. So you come to the point where you don't really care. And that's a sad part of addiction because at some point, your life doesn't present as much of a value to you is that drug of choice that you are seeking.
Yeah, that's sad.
So that's a very scary and sad part. That's why we are having this conversation, because addiction is killing people. So assessing your level of self-harming behavior, meaning going through your history, meaning going through the current situation, is very, very important for us. And then after all of that done, and hopefully we approve finally that you can admit to the program, a person will come to our facility. They will be situated by our frontline staff. We will explain to you the rules of the program. You will receive orientation package. And again, depending on the time of the day that you came to the program, you may start this program right away. If you admit it, let's say evening time, you'll probably come to our housing, and then the next day you will start with actual treatment.
Now, you were talking, when people think of treatment, they think very simple, outpatient, inpatient. Okay, and you have one in the middle.
Well, we are a very unique hybrid.
Yeah, explain what the way you do it, because it seems to be a very good model that's even less expensive than some of the 28-day typical programs.
Absolutely. So at our partial hospitalization program and our intensive outpatient program, we offer housing that goes along with it. It's not residential program. However, it mimics it closely.
So they live...
So they live in a house that would look like yours and my house.
Right, right.
Okay, it's shared between those clients that are in the program. We have male and female houses, so they're separated by gender. They are located fairly close to each other. We provide transportation from that house to the program and back. At the PHP level of care, we also provide a lot of other things for the clients, which kind of pretty much makes their stay very comfortable. So food will be taken care of for them. We take clients shopping. They obviously will prepare meals for themselves, but you know the shopping part, our program will.
But they show back. They come to that treatment center.
Yes,
early in the morning, and they stay there all day.
Yes, they come at 9 a.m. So the program itself starts at 9:30, and it goes until 3 p.m. There is a 1 hour lunch break. But it's a 5 hours of group therapy that happens within that period of time.
That's a good amount of treatment. When you think, as you say, the residential, where they're living there all the time, they probably get as much, if not more, being brought to the treatment center.
Absolutely.
And just focusing on treatment.
Right, and housing components ensures that they're in a controlled environment.
Right.
They are supervised 24/7. So you've asked earlier about if I was a loved one that wanted to have my son or daughter or spouse in treatment. I want to make sure they are safe, they're not using. So that's what that housing component ensures, because let's say you're coming from home and you're in early recovery. Yes, you've done this 5 hours of groups, but then you went back and no one is really keeping you accountable. So within the program, that piece is taken care of. There's staff there 24/7. Clients are obviously supervised and monitored. They receive support if they're going through cravings, if they're going through post-acute withdrawal symptoms. Majority of our staff is in recovery, so they would know exactly what's going on, and they can relate, they can give a good advice, they can help you sit through those cravings, and hopefully it gets better. So that's a unique component of the program that increases chances for a person to be successful in what they are trying to achieve.
So like you're saying, it's really, they are in a 24/7, monitored and supervised program, but they live in one house and they come over. That's fascinating. And what is that called? PHP?
It's called Partial Hospitalization Program, and PHP would be abbreviation.
And that's probably all over the country. It's probably a model that's being used everywhere.
Well, there are lots of PHPs out there. However, not that many of them would offer housing. In a way, we are very unique. I worked on the mental health side for a long time, and there are plenty of mental health PHPs. However, rarely we see housing being offered.
Housing's the key for everything.
So having a bed, an actual bed in treatment, is precious. So this program offers that. And it's not a bed in a locked psych unit. It's a bed in a comfortable home. Yes, it's not your home, but it mimics closely a family home environment to make it easier on the person. So many patients that come to us for the first time, they would ask this question, is this like a psych unit? And or they refer, is this like a jail? And I said, no. If this is a jail, it's a very comfortable jail. Yeah, it's a 5-star jail. Yeah, so it's very comfortable, family-like atmosphere. People around you would understand a lot of what you're going through.
And that's the idea. You want that comfort. Okay, we're going to take another short break,
all right,
Viktoriya, and then we're going to talk about the treatment process, what goes on, and then what happens when they go home.
All right.
Okay, so we're talking about drug treatment. We're going to take a short break, so stay with us. We're coming right back.
Spend 15 minutes watching online videos like this one.
Brushing for 2 minutes now can save your child from severe tooth pain later. 2 minutes twice a day. They have the time.
Most party fouls are pretty dumb. But if you decide to drink and drive underage, you could lose your license and your freedom. Underage drinking and driving. The ultimate party foul.
There's one thing you can never have sex without.
It's not something you buy.
Or something you take.
In fact, there's only one way to get it.
It has to be given to you, freely.
It's consent.
Because sex without it isn't sex.
It's rape. Consent.
If you don't get it, you don't get it. It's on us to stop sexual assault.
Learn how and take the pledge at itsonus.org.
Hi, welcome back to Straight Talk. We're talking about opiate treatment. What's the best treatment? What's the best resource? And we're having a lot of help here from Viktoriya Karakcheyeva, I'm trying to get her last name right, who is a clinical director at the Fresh Start Recovery Center, which is in Gaithersburg, Maryland. But she's giving us information that you can use anywhere in this country to find the best treatment. Viktoriya, you were talking about this partial hospitalization. You get them in a center, and then they start going through education and counseling, and you were saying they're in there like 5 or 6 hours a day in the counseling. Is it group counseling, individual? How does that work?
It's a combination of several things. Majority of partial hospitalization treatment would be group. However, a long visit would go individual counseling. So as people admit to Fresh Start, they are assigned their individual therapist that will be working with them and meeting with them one-on-one. And again, we try to assess clients' preferences in terms of what works better for them. And though group therapy would be a primary modality, if we see that you open up a little bit more in individual, we'll try to give you more. There is also family work that goes along with it, and I've mentioned earlier that we believe that addiction is a family disease. So having people that are in your support circles involved in that process is very important. So family sessions, couple sessions would accompany treatment very often. And part of our assessment that we on the therapeutic side do would be talking to a family member, because very often the side of the story that they give us is very unique,
yeah, probably
right?
Different.
Well, addiction, like I've mentioned before, affects your ability to exercise judgment and insight over what's going on. So you may not necessarily see what's going on as a problem, however, your environment may show otherwise.
When someone says to you, how long should he or she stay in treatment? What do you tell them?
Well, I try to draw a parallel between something that is non-addiction related. Let's say you're trying to lose weight, right? You went to this wonderful diet and you've lost X amount of pounds, but then you went right back into your habit of overeating, not exercising, and you gained back 15, right? So in a way, your treatment with us would be helping you to get that foundation. Addiction treatment means that you are getting tools to be able to deal with your cravings, to be able to gain refusal skills, to be able to build support network, because treatment is never forever, right? And though we say we would like to keep you in treatment for 30 days at least at the PHP level of care, and this amount of time we believe is sufficient to make you start making changes with the habit that you have and start developing a new habit. However, it's not sufficient to give you a lifelong recovery, because lifelong recovery is a lifelong effort.
So when they leave your program, they go into some kind of a program? Aftercare?
Yes. So after PHP program, which typically lasts 30 days, and it may vary depending on the, on the case by case. It can be a little longer. But then after that, we recommend you to step down to intensive outpatient program, which is less intensive. So we start with 5 days a week for 3 hours a day. And we have morning track that goes from 9:30 till 12:30. And then we have evening track that happening from 6 till 9 p.m.
So it's like a step down. So
yeah,
they'll do the 30 and maybe they'll get a job or live in a recovery house, but they're still coming back
to the program.
For more treatment.
So it's not a drop from 24/7 to nothing, right? It doesn't work that way.
And that could last
It could last
long as they need it?
Well, in our facility, since we do also provide sober housing that goes along with our IAP program, it typically lasts 6 to 8 weeks. However, there are lots of IAPs out there that last much longer, and they may not necessarily have housing. We do not put necessarily like a hard limit on how long a person can be in IAP level of care. It is determined clinically, and it can go beyond 6 to 8 weeks. And then if the person is doing well, let's say they are working, they are not using, they are going to 12-step meetings in the community, they maybe got a sponsor, they feel that they are slowly gaining that life-transforming I guess, way of looking at things, and knowing that I need to say no to the substance in order to say yes to so many other things that I want in my life. Then we will transfer them to what's called outpatient, which would be they meet with therapists maybe twice or once a week, and they can do a combination of maybe 1 hour therapy and 1 hour group.
So we're looking at a process of stepping down slowly, so you're not just dropping them off.
Right.
But you're also supporting 12-step. You're also saying, support programs, recovery houses. That process doesn't end.
It does not.
It just keeps going.
Because the recovery is a lifelong journey.
Right. And I think that says it all. I mean, when you say that, like it is, and I think the work that you're doing is amazing. I could talk to you about this forever, and I know we'll have you back to keep talking about this treatment. But we wanted to just kind of get going with educating the public. Because I think what you do is so important that they need to know. So I want to thank you so much for everything you do. Viktoriya Karakcheyeva, pretty close. He's a clinical director at the Fresh Start Recovery Center. She's in Gaithersburg, Maryland. It's part of the Amatis Health network of treatment centers, and we can't thank them enough, and thank you for everything you do. I want to thank all of you for watching Straight Talk, for trying to educate you and the people you care about this epidemic. And if you know someone that has a problem with alcohol or drugs, please try to get them help. I want to thank you for watching Straight Talk, and we'll see you next time.